Well, thank you very much for coming to this conversation today. Our programs that ran the Food Market Workshop at the 2025 National Conference are all here today to have an important conversation as we celebrate National Nutrition Month. This year's theme for National Nutrition Month is Discover the Power of Nutrition, since nutrition has the power to help individuals and communities. And all three of the people here on today's discussion are a part of a mobile program that is doing just that, improving their communities by bringing nutrition out to where it is mostly needed. And so, with that, I would like to introduce the individual members that are here today to talk about their programs, but not just to talk about their programs, but also just how deeply nutrition affects the whole health of a person and the community, and what we can do to improve on health outcomes by just bringing good quality food where it's needed most. So first, I would like to introduce Hannah Ulloa, and she comes from Miami, for caring for Miami Mobile Food Market Program. And she comes to the program by ways of being a nutrition intern. Now she's a volunteer coordinator and a program administrator for Caring for Miami. And so we would like to welcome her to this conversation. Next, I'd also like to introduce Kelly Parker. She's a nurse manager for the Carl Mobile Health Services and Carl Mobile Market. And so thank you today, Kelly. And last but certainly not least, we've got Melanie Ernest with Virtual Eat Well. And Melanie is a director of community-based programs, and she is a part of this Eat Well initiative and also mobile food pharmacy. And so thank you so much for joining us today. We are really looking forward to this conversation. Before we get into some questions for today, I would love to go across the line and have each of you share with us a little bit about your origin story. How did you become the program that you are today?
For sure. So at Caring for Miami, we started back in 2009, and we started with only a mobile dental clinic, and that would go out maybe twice a month a year, twice a month, like every month. And so we would only go out 24 times a year. And over the years, as we developed our other food program, which is our Weekend Meals for Kids program that helps children on the weekends who don't get food because the only food that they're able to get is in school. We were like, but there's still more of a need in the community. And we really realized a big gap in oral, like dental health and the food that people eat. And so, like people aren't as willing to, come get their teeth checked, but we're like, people would be willing to get food, and they need food, and good food to help their teeth. And so that's kind of how the mobile market kind of got started. And it was shortly after 2020 that Ashley, our executive director, she had this vision of just like mobile, because we had our mobile dental clinic, and she really loved how the benefits of what mobile units can do. They can go to the community, meet people where they are. And so that's how it kind of started. And the we got donated to us by the Miami-Dade Metro system, a Metro bus. That was donated to us, that we retrofitted into a single aisle grocery store on wheels to be able to serve people in the community. And right now we go to 12 different sites a month. So we go out like 3 times a week, consistently, all the way from like the southern end of Miami, like the end of Florida, all the way to like Opelika, which is like an hour north. So we serve like a great big population of people, and we've seen the change. So that's where we came from, and that's where we are now.
Thank you very much, Hannah. I would also now like to pass it over to Kelly Parker from Carl Health. And Kelly, can you share how your mobile program originated? How did you identify the need? How does it evolve to what it is today?
Yeah, thanks so much. So I am from a pretty large healthcare system in central Illinois, and we first launched our first mobile health clinic, which is truly just a full service walk-in clinic for really anyone, regardless of ability to pay or insurance or whatever, from birth all the way up to geriatric. So we started this because the access to getting into care here in our area is just very limited. I mean, it's months and months before, to be able to be seen by a primary care and up to sometimes 6 to 9 months to be seen by specialty. So we really launched our mobile clinic to be an extension of that healthcare system, but also just to be that quick and easy access. But after 2 years of providing these services and doing social drivers of health screenings, food insecurity was positive. I mean, I would say probably 80% of the time, right? And so what we were identifying as we want to provide holistic health care, we want to provide those holistic approaches. Food insecurity and providing healthy food access was became a pretty high priority. We also were donated a metro bus. It was through our mass transit district here in Champaign. They were upgrading all of their buses, and that's how it initially started. We actually had a local garden that was doing a couple of outreach things, and they were like, "Hey, if you partner with us, can I just almost operate our mobile or almost a farmer's market out of your unit?" And so we said, absolutely, let's figure that out. And so we were at first, we were just kind of the landlords, right? We drove the bus because we were the CDL drivers, and they were parking right next to our mobile health clinic so that way we created that hub of resources. But then they were kind of operating out of it. And then, of course, after COVID and all that fun stuff, they all kind of fell away. But we were really determined to keep it going because we saw the positive impact. We saw that connection between getting health care and then having that provider walk that patient right over to that mobile food pantry or that mobile produce area or farmer's market, whatever you want to call it, and then discussing in real time about good food for diabetes care, good food for, hypertension or cardiovascular disease, or even just healthy foods in general that's going to promote your health in the long term. It just was such a positive impact. And then we launched our second mobile market over in a different county, actually just a year ago. We were able to procure some grant funding just because the food insecurity in that county was just such a high need. And so we do really kind of try to do the two things together, which has been really impactful. And I'm so blessed to be a part of a large healthcare system that I can kind of tap on the shoulders of my nutritionists and my food folks to say, hey, help me, provide recipe cards, help me provide, food prep or healthy food prep, because you can take a really great vegetable, but if you fry it in grease or you put it in, you put a pound of butter on it, right? My mom, it doesn't go that well, right? And so that's where it's really important to not only have the access to foods, but the education, the understanding of how to prepare it, how to incorporate it into your diet, and then having the means to do so, right? Because affordability is a huge process. I'm one of the newer people. I know that the Miami program, and I know Melanie, for instance, they're much further along in this. I still feel like I'm pretty new, so I've even been learning a lot from them as well. So I appreciate being on here with them because they're more of the experts in this field.
Thank you very much, Kelly. And
Yeah,
from outsider looking in, the growth that you've experienced in a short amount of time has been tremendous. So congratulations to you on
thank
all of the
you.
efforts, even if you feel like a newbie. And Melanie, please, love for you to share with the group a little bit about your program, where you started, where you've evolved to today. How did you get into having this formalized mobile food pharmacy? And that's pharmacy with an F.
At Virtual Health, because we're a nonprofit healthcare system, every 3 years we participate in a community health needs assessment. So in 2016, two of the top needs were access to affordable foods and access to reliable transportation. As a healthcare system, we sort of like wondered how can we influence these things? We couldn't really influence transportation infrastructure, but we could bring healthful fruits and vegetables out into some food desert communities in southern New Jersey. So that's where we started with our flagship program was a mobile farmers market. And we just partnered with some local growers. For anyone who's not familiar, New Jersey is the Garden State. We are called that for a reason. The reason is the part of the state where I live. So um, we were very fortunate to have access to local growers. And when we started our um, mobile farmers market program, the reception in the community was just phenomenal. We operated that program alone for a couple of years, and then we were presented with the opportunity to buy a New Jersey Transit bus for the grand sum of $1. So we retrofitted that bus into a one-aisle grocery store. We lovingly dubbed her Betsy, and we took her out into the community, and we were able to serve the community with a full-service mobile grocery store. So dairy, breads, produce items, frozen foods, shelf-stable goods, um, and influenced by dietitians. So at least 80% of the goods on board were healthier versions of the things that the community requested. Um, and Kim mentioned today, we also operate a mobile food pharmacy, which is a clinical outpatient dietetic program that offers medical nutrition therapy and medically tailored groceries to consumers who are managing a chronic diet-related health condition and food insecurity. So we really are um, able to lean into a food as medicine mindset. And like like you mentioned, Kelly, being part of a large healthcare system is such a benefit. We have the absolute support of the healthcare system, and it's excellent to make those connections for patients.
Thank you very much, Melanie. And every one of you, different parts of the country, different types of organizations, but a common thread that we got a Metro bus that was donated or sold for $1. So I love that there's this common theme through all three of you, your programs. You all said something that was it was a common theme between your introductions, and that was uh, the notion of providing a need, food. We need food. We need nutritious food. And you were doing other types of services that weren't necessarily a mobile market before you got into this space of formalizing a mobile market in your community. But it also seems like it's an entry point to reaching community members that may not have otherwise sought you out for the services that you were originally providing. So can you share a little bit about, I guess, that mobile advantage as far as, having a mobile market, going out into the community and being able to provide what they need and how it is, what your experience has been in building trust, and gaining access to other members of the community and what it looks like for them to now receive the other services, the other offerings that you have within your programs?
Yeah, I'll go. So like I said before, it's like it's us going to them. And what we've realized a lot in our community is a lot of these people that we're serving, they don't have access to transportation. They don't have cars. There's a very horrible like metro bus system in the southern part of Miami. And so, they can't even take the bus. And so we're going to them, and we've seen how, at first when we go to new places, they're like, "What is this?" Like they're so confused. They've never seen anything like it before in their lives. And then we're like, "It's a mobile food market." And so when they go in, they're like, "Wow, this is amazing." And it's like for them and their communities, they don't have the grocery stores that you and I go to. They don't have a Publix. I don't know Kroger, whatever is near you guys. But and so for them, they have these little like supermarkets that are not supermarkets, like little markets. They're very small, kind of like bodegas, which there's barely any produce in them. I've driven by them before, and there's really not a lot that they offer. And so for these families to come and shop for free, all at no cost and get to shop for like meat, produce, dairy, like spices, like olive oil, like all these types of things. It's just you see it in their face when they walk in. So that's been like the real advantage is being able to go to the communities, and when we start to go consistently, it's like they expect it. We're like we're coming on this day every month, and they're right when we get there, they're all lined up. So they know, and they tell their friends about it and everything. So we just had an amazing experience and have been able to bless them so much.
Yeah, I'll go next. I agree that I think that just simply by entering into neighborhoods that a lot of other services may not enter, because I feel like that's one of the advantages of mobile is we target those high need areas that might also be high in violence, high in crime. Maybe some other places might not be willing to go in there, but we do. And that immediately starts to build that connection, that trust, and that kind of for them to say, wow, I can't believe this entity or even a big health system like Carl, like, because we're kind of all over the map, especially in Illinois, I can't believe they're coming and doing this for us, right? So not only does that help build that trust with them coming to us for food, but then they might even be more inclined to go seek primary care or go somewhere else to get their care done. So, just being able to literally come, I mean, we don't go to their front doors. I've literally had people ask me if I can pull up in their driveways, right? And I wish that was something we could do. We're actually developing kind of a pre-order delivery program for some of these big, more like higher conglomerate areas of these housing authority locations or some of the assisted livings where, the older generation that doesn't really have the ability to get around. We're kind of working with their community folks to provide that service where we're literally letting them almost grocery shop off a list and then we deliver it to them. But that right there, I think just by us entering their space and not expecting them to always enter our space is a huge change. And I think that's going to be a huge change in healthcare in general, which it always includes food, because we've kind of gotten away from that connectivity and that the expectation that everybody's got to drop everything and come to us while we're coming to them now. But that's what makes mobile very accessible. It makes mobile very unique, and it makes us some of the most, flexible and unique areas that are out there because nothing's off limits, right? And my team will bring me an idea, and I'm like, well, let's figure that out, right? It might not be exactly what they wanted, but we start off with a little something small, and then we figure out and we grow as we build it out. So, I mean, one of the cool things that we started doing is there was a local, it was called Solidarity Gardens here in Champaign County. And they said, hey, I really think it would be cool if you see people that are wanting all this produce, how about we come in and we help them start their own garden? And so they had funds that they were able to provide gardening equipment, soil, even pots to families that even lived in apartments that they could set things in their windowsills where they could start growing their own tomato plant or growing their own, little things like that. And it was such a cool thing because we were able to, again, not only provide them food right then, but we were also helping provide them the education, the supplies, the resources to start doing it themselves, which that self-sustainability is so impactful to a lot of families.
Absolutely, absolutely. It's that whole notion of, teach a person to fish mentality.
Yeah, yeah,
Thank you, Kelly. Melanie,
yeah.
can you share with us in your program what you've been able to see as far as bringing food to the community, what it's done to build trust and encourage people to seek other healthcare needs that they may have?
So it's funny how Kelly, your program and my program seem like they're running parallel tracks because you just mentioned, growing food and things like that. One of the ways that so when Virtually Eat Well goes out, we don't randomly go to neighborhoods. We are referred, and typically we're referred by another consumer. So if someone visits our mobile markets regularly, they'll say, you know what? My mother would really benefit from this. She lives in this neighborhood in this town. Do you think you could go there? And our community health workers, so our programs are staffed by two community health workers, a CDL driver and dietetic interns from local universities. Our community health workers are hired from the communities that we serve. So our programs really help bridge the sometimes systemic distrust around large healthcare systems. So we're not looking to be another front door to the healthcare system. We're really looking to be more like a front porch where neighbors can come and sit and get comfortable with the idea of taking care of their health and talk to a neighbor, talk to someone from their community about recipes or ideas, or now, growing their own food. We were able to partner with the Pinelands Preservation Alliance, which is a local nonprofit organization geared towards farmers and growing farming communities. And they have a program called Root Camp, and it teaches children to grow their own food. We've sort of adapted that model, and we present that once a month at some of the communities we serve. So our regular consumers can come out. They've planted herbs and some things that are like cucumbers that are really nearly impossible to kill unless you super neglect them. But just being part of the community, showing up week after week and getting to know our consumers and letting them get to know us has been just absolutely key to building the program.
Thank you very much, Melanie. Another common theme that I'm hearing from all of these programs is that you're not just bringing food to the community, you're bringing it with dignity. And even though your markets came by means of a donated Metro bus, they look like Whole Foods on wheels. You're not just delivering food, you're delivering it in a very beautiful, thoughtful way. And I can that also I cannot imagine that that also contributes to how you're building trust in the community when you see that you care about the members of the community. And with that, as you think about your own respective programs, are there any particular stories that come to mind, an individual story that sticks out that has, really stuck with you over the time of your program, whether it's an individual person or a family, something that really you really saw that you coming out to the community and having this mobile market has really had a deep impact on a particular person or situation. And if you want to start.
Yeah, sure. I remember one of the first times that we went out when we first launched in like 2023 of February. We went to this little community in Little Haiti, and this is the first time we had ever gone out. And we were like, okay, what are people gonna think of this? It's worked well for other people, but how's it gonna go? And so we're all just, so stressed about it on like the work end. And then when you see the actual people, you kind of like take a step back for a moment and realize, okay, this is for them. All this stress that's going on in the back end, like let's put things into perspective, because for them, we're trying to make this the best experience possible, and it will be for them. And so we had one lady that she came, she had a few kids with her, and she was like, you could see her face downcast, just very sad, very, she looked depressed, exhausted. So she comes, she doesn't even know what this is, and we told her, we're like, you can step inside and get free food. And she was like, really? Like she still looked a little skeptical. We're like, yes, yes, you can just step inside. You have a shopper that can help you. And she was like, okay. And so, she wasn't talking a lot. And so when she went in, and like you see her go in, and then we see her come out, and her face is just like the complete opposite of what it was before she came in. She was like smiling, her teeth were showing, she was just so grateful. She was like tears of joy. And so that's something that like has always stuck with me since like the very beginning, day one.
That's a beautiful story. Thank you, Hannah. Nothing like seeing somebody smile as a result of the work that you do.
Hannah, I absolutely love what you said about kind of all the work that goes on in the background and how frustrating it can be, and how you're trying to bang down walls or do all this stuff, and you can get so internally frustrated and feel like you're on this hamster wheel or this treadmill and never going anywhere. And then you see something out in the community or something come to life, and you're like, oh, dang, that was totally worth it, right? I'm dealing with like Lincoln Snap right now, and I'm ready to like walk to Baltimore where the USDA holds these things, and I'm ready to like shake people. But yeah, so I know I appreciate you saying that. I will say that like another incorporation that we started doing is working directly with MCOs like Molina, Meridian, Blue Cross Blue Shield, and doing some of these large like care gap closure events. We started doing that kind of back in, well, it was like back in, I don't know, September 6th, I think was our very first one. And, because they can give incentives to patients, literally like, here's your incentive dollar for getting your pap smear, here's this or that. Well, so instead of doing cash, what we started doing was they were stocking, like this is what they did around the holidays. They stocked our mobile market with like free turkeys, free hams, like all of the things that you would need for like a holiday meal. And it was such a cool thing because then these families came on the mobile market after, getting a full exam or whatever that was. We provided them with all of their box for the holiday stuff, and then we had them in our grasp where we could then provide them with all of this education around even incorporating the healthy foods into a holiday meal because we all love the pies. We love the mashed potatoes, right? Put homemade noodles on everything and that's all I'm going to eat, right? But again, it's one of those things you have to like really try to, when you have your arms wrapped around them, to be able to take every moment you can get. And we had so many families that ended up staying with us for much, much longer, just because they were interested and they felt like that we had taken so much time and energy and effort into incorporating that into healthcare that maybe had never been done before. Anybody that goes to a primary care visit, you got 15 minutes, right? They want you in, they want you out. Well, what we do so differently is I'm like, well, however you want to stay, if you don't want to stay and chit chat, that's fine. And so we don't really have appointment slots. And so I feel like with those kind of things, I don't know if I have like one specific one, but just the people that continue to come back to us because we provide them that time and we give them our energy and we give them our attention, it really then it brings them back to our doors and it really promotes that trust. And again, it's about being a good neighbor, right? And that's just what we all want to do.
Sometimes it's neighbors that really make the program for other neighbors. Um, Thinking about the question, is there someone who, or a story that really was impactful to me? There is. Um, my first week on the job, we were entering a new community, and there was this almost like the matriarch of this of the block. She was just a cantankerous woman who didn't really want our giant bus blocking the driveway. We weren't blocking the driveway. We had the permits. We were in a good spot. But she didn't like the looks of us. Um, she was insulted when she thought that we were bringing free food to her neighborhood. She was relieved to learn that it wasn't a pantry style situation, that it is a retail store. We do receive a lot of grant funding that allows us to reduce the prices of goods on board our mobile grocery and mobile farmers market. But once she realized that there was dignity in that experience, in the way that she wanted to feel it, um, she became the biggest champion for our program. I have now known this woman for 4.5 years. She calls me regularly to tell me what recipes she's making. She was able to lower her A1C from 11 to a 7 over the course of the time that we've known each other. And it's all because of the way that she views food and her access to healthier foods and her sometimes reluctant willingness, but willingness nonetheless to try new things now that she knows us and she trusts us and she looks for us. So just building those relationships and seeing the difference that we make in people's lives, it's incredible.
What amazing outcome of somebody that it's a great story, and not only how nutrition has helped to heal this person's health, but just how it nutrition and healthy foods has built allowed to build trust in that community as well. So that's a wonderful story, and it segues into the next topic, which is, and some of you've already alluded to it. What are some creative ways in which you're helping people learn about nutrition? And sometimes it comes by means of knowing that we're doing this with dignity, or that, tying it in to a holiday that has a lot of appeal. But have you found that there's some other things that you've had to be creative about? Maybe it's, being culturally appropriate types of foods, so that you can build trust in that regard. What are some of the things that you've done strategically in order for the members of the community to be able to relate, in order to have their ears and their minds open up to the notion of healthy foods, good nutrition?
So, you said something there that I was gonna say, which is like culturally appropriate foods. So, like, we need to know the demographic of where we're going to. And so for that reason, we had kind of like anticipated that in the beginning before we started. And when I was brought on, when I was still in college studying nutrition, I was asked to make recipe cards and for different cultures because Miami is a melting pot. So we have everybody here. And so I made like all different kinds of recipes for all the different cultures that we would be seeing. And so whenever we go out into the community, we put out the specific recipe cards there of food that they would like. And, we've also asked people, we haven't just assumed that, oh no, this culture likes this culture likes this. We've asked people that are in those cultures, so we're getting accurate information. So we've done that. And we've also done like chronic disease pamphlets for eating as well, which is something that I developed alongside a registered dietitian at the time. So we did like recipe cards, chronic disease pamphlets for heart disease, for we also did some like risky behaviors for like smoking, like smoking habits, alcohol drinking, things that, people, it's just their culture. That's what they grew up doing, but they don't realize what impact that has on their health. And so we've done those type of pamphlets, which is really easy because, you make them and then you put them in like little stands where when they're checking out, when people are bagging their groceries, like they can look at it, they can get one. And so it's really, really simple recipes, really easy. And so we've seen that people are receptive and they really like that.
We've talked so much about even just like healthy fruits and vegetables, which is always a big thing, and even dairies and stuff. But one of the things that we did, just to talk about something a little bit differently, is we tapped into our University of Illinois has a deer donation program where hunters can fill like an additional hunting tag because they might only want one deer for themselves, or they buy an additional tag and then they can donate this deer to a local processor that we work with. And then we're then able to give out venison on the mobile market for free. These are not meats that we sell, but you're talking about a very healthy, lean protein, a lean red meat, a lean protein that families can incorporate into their diets. And again, it's obviously harvested right here in our own backyards, right? We all see the dead deer on the street, which nobody wants to eat. But on the flip side, if it's everything is, we do have a pretty big overpopulation of deer, and that's why we do have open hunting seasons. And so we're able to tap into a lot of extra hunters and say, hey, we'll buy your extra tag if you donate it, right? And so then we're able to then, help people understand about cooking venison, freezing it, the proper processing of it, and then how to, because I think when they think healthy, the only thing they're thinking of is fruits and vegetables, right? But we have to really think about how we're adding in those proteins and what those lean proteins are, that then we can, really help to get those out there too. Another thing is one of the farmers that we work with has a hydroponics farm. And so if you know anything about hydroponics farms, you have to have these big tilapia tanks that's like where the water gets their nutrients to feed the plants and the lettuce or whatever that is they're growing. And so we've been able to tap into them as well about, freezing these tilapia fillets and getting those out there too. So just being able to incorporate some of the proteins is a big piece, and giving that education around it, because people are like, I'm not eating no deer. I grew up in Southern Illinois and I did not have deer till I was like a well-grown adult. And so, because there was that fear around it, I think, of, oh, what's it going to taste like? Is it going to be chewy, gamey, or anything like that? It actually isn't. It tastes amazing. You just have to know how to cook it. So it's just kind of providing that information.
The Eat Well programs, having local universities send their fifth-year dietetic students to do a community health rotation on board our mobile markets brings a lot of novelty to the markets for consumers so they can come on board. And our students are really eager to give lessons on the benefits of herbs, or how much salt is in your condiment, or how much sugar you're consuming that you might not even realize you're eating. So having those sort of novel interactions with students keeps everyone more engaged on the market. We also have a produce item of the week on our mobile farmers market. So um, I mentioned this is the Garden State. Our growing season is from March through October. We choose a local legend that is in season and offer a contest for uh, any consumers or staff who want to throw their hat in on a food preparation contest, complete with photos and recipes on our social media. So we try to keep it fun. Nutrition and health sometimes feels really cumbersome and overwhelming for people. So the more approachable we can make it, I think the better our engagement stays.
This is fantastic. Just listening to all of the creative solutions that you are bringing to your communities, and they're all unique because you live in different parts of the country. Um, at the end of the day, though, this is still mobile, right? And so comes all of the things, for better or for worse, that are mobile, right? And for our listeners out there, whether they are already providing some sort of mobile market service or they're thinking about, they're just like you, they're in that position where they're providing other services and they're thinking about how can we address food insecurity in the community? Can you share a valuable lesson that you have learned through this work that you're doing that could be really helpful to those listening to this discussion?
To people starting out, I think the first thing I would say is that they really need to get to know their community. I had kind of mentioned this before, but if you don't know your community, there's only so much help that you can give them, like lasting help. And so I think that's the first thing I would say is learn the culture, learn what they like, what they don't like. And then another thing I would say is like a lot of it is just trial and error. And you have to be okay with that, because the amount of times something has like gone wrong and we've learned from it, it's part of the job. And so it was helpful though when we were starting is we talked to some other people who had mobile units. And so everything was very helpful. But I think each specific community that we're in is so different. And so there is going to be some trial and error in that. And that's okay because we learn.
I feel like my mantra with everything starting out new is start extremely small. The last thing you want to do is overstretch or take too big of a bite and then fail. Because, like Hannah said, the last thing you want to do is go into a community and provide them a service that they don't need. And then they immediately are like, you don't know us, you don't belong here, right? So we started off doing like literally a little farmer's market food stand outside of the mobile clinic under a tent and just tried to see what it would look like if we gave food away, if we charged a little bit, or if we did a donation based. We tried a few different things before we really jumped into getting a vehicle, and starting all this stuff. We really tried to, gather information just based on doing something very, very small. I'm in sweet corn country, and so we have a lot of farmers that are like, "Hey, well, I'll donate a pallet of sweet corn." And so that's kind of like, hey, well, we'll just pull it right up. And then we started buying some extra stuff and just giving it out. So my biggest thing is always start small with something that's very reasonable that you can handle on your own without bringing in more staff, bringing in more people that you can own and that you can handle. And then you kind of iron out all your wrinkles. And then you give yourself the ability to scale it up in small increments. And so that is always my big motto with anything that you're starting out with.
Excellent advice from both of you. Um, and really, those lessons, they're valuable lessons. Um, listening to the communities that you'd like to serve and really getting to know them and getting to know what's important. Is it food that is donated? Is it food that you purchase? What other things are of value? How can you stack value added services for consumers that you're visiting? And yeah, keeping your expectations realistic. That's a tricky one sometimes because we all go into this work and our hearts are overflowing and our wallets are usually not. So making sure the juice is worth the squeeze when you are stewarding your resources is probably the most important piece of advice that I could ever share with someone.
Well, celebrating even the small wins, right, Melanie? Because sometimes, I mean, even in just the success stories that you guys shared with us, right, those are huge wins for your team. And so, sharing those with donors, sharing those with like you're just because that's, I think, what keeps you going day to day when other things might not go in the right direction.
Some
Oh,
really great
completely.
advice. Great advice. Start small, willing to take risks, stewarding your resources, all of the fundamentals that are of mobile health in general. It sounds like it definitely applies to the mobile market space as well, which brings us to the next topic. Partnerships have always been integral in mobile health care. And partnerships, even just from our conversation today, you can hear how vital those partnerships are. But the partnerships, do they look different? Are you able to go to some of the same partners to a certain degree to help launch a mobile market? How are you finding new partners? Because obviously you also have different needs in launching a mobile market itself. So I'd love to hear from each of you on what those partnerships look like and how important are they to the success of a mobile market?
So, when we first started, we got a grant from the Florida Department of Health, which really helped us get everything that we needed to for the mobile market to be able to get it like rolling. And these are kind of like the supplies, the supply part of it. So, that was really helpful as like the first thing to kind of get us off the ground. And then after that, we were like, okay, well, we have to get food now. And so we started reaching out to like food procurement partners, like grocery stores. We have a great relationship with Trader Joe's. So we pick up from them. We call it glean. We glean from them every Monday, Wednesday, and Friday. And so they give us like pallets of food, and it's good quality stuff, like top tier quality stuff. And so the community is very blessed by that. We have Mac Edwards produce, we have JC Tropicals produce, we have Publix. So we have different grocery stores, supermarkets that we have reached out to. So we'll kind of, if we're in person, we'll talk to the manager about it. We'll email them like a case for support saying like, hey, if you're able to do this for us, this would be, the impact that could be made in the community. Kind of give them like a reason because a lot of these grocery stores, I mean, they don't want to throw out food from what we found, but a lot of them do, because they don't know where to give it to. So it's kind of like you're taking something off their plate for them to be like, oh, perfect. We don't have to throw away this food. We can give it to other people. At least that's how the food partnerships that we've had have gone, which is really a blessing. And then we also need like volunteers to help run this. So that's another thing is like for us being attached to a bigger entity, Christ Fellowship Church in Miami, we're like their nonprofit, that has been like the world of a difference because I mean, our team is so small, there's just a few of us. And again, like we don't have like that much money just in ourselves. And so we're not going to hire like 100 staff. And so we really run on volunteers. And in our database, like currently we have 1,500 volunteers that like day in and day out because our programs run from like Monday to Saturday, that they come in every day, multiple times, multiple different programs and help us run everything. And so without them, I don't know what we would do. So they are awesome. So that's something else that has just helped us with this program.
We're actually still developing a lot of partnerships with like groceries and things like that. We're primarily ordering from a wholesaler that Carl orders from, like our cafeteria and all of our like little food pop-ups around all of our clinics and things like that. And they're giving us a pretty decent price. But what we have found is like Hannah said, the quality of our food is so much better than just going to Walmart, which is what most people have access to, that even people that don't really have food insecurity, they're almost utilizing us as a farm, like a farmer's market, because the food will last so much longer on a shelf or in the refrigerator or something like that, because it's not been sitting in a grocery store for a few weeks. But we're really mainly utilizing our partners in regards to marketing, advertising advertising, really creating that trusting handoff, right? Working with local faith communities, school districts, things like that that advertise for us because sometimes those cold calls are people just kind of walking by being like, "What are you? What are you doing?" Right? And then we say, somebody might have had a really negative, interaction at Carl Health System, whether with a nurse or a doctor, and then they see Carl Mobile Market and they're like, well, they're out to get me again, right? And so even though we're part of this health system, which is a great thing, sometimes that can also be a negative impact as well. So we really try to work with a lot of these local folks that know the community, know those neighborhoods specifically much more than what we do, to really be that warm handoff or that warm introduction that creates that trust a lot quicker. So we're still working to develop, some, we've got a volunteer pool with one of the local high schools. Their athletes are able to come over and get some credit, right, and some volunteer hours by helping us load, unload, clean, all of that kind of stuff. But primarily, we are still kind of working to develop and build out a lot of those other partnerships. The only other thing too is, like I said, when we get some local like gardeners that want to come help. So they come out and provide services, which isn't necessarily a partnership, but it does bring about more services or more resources that then helps people to hopefully utilize all of these great offerings that we have out there. So
Building community partnerships it's an integral part of, I think, any mobile program is having that trust in the community. But one of the things that I've learned that I didn't consider when I stepped into this role is what happens to the food that's left at the end of the week that we don't sell or that we can't get into the community. So some of the partnerships that I think I'm most proud of building and really show some excellent, just I think it's such a creative use of the resources. And one of our team members, his name is Jose, he came up with this brilliant notion that we should partner with a local farm to give back any of the produce items that are not usable for human consumption at the end of the week. So we're purchasing food from agricultural gardens, and then we're providing donations back for the animals on these farms to eat at the end of the week. So there really creates that sort of symbiosis and just makes for such a nice story, especially, I grew up on a farm in southern New Jersey, so it warms all the parts of my heart at once to see that happen.
That's a very thoughtful and creative way of making sure that even the food that you're giving out into the community, to those who need it, that food that's left over is not wasted either. So that's a very creative solution. And we loved hearing about all of the ways you're partnering and the different solutions to procuring food, distributing food, getting the word out into your community. So as you look ahead and not just looking ahead within your community, your program, just kind of in a very general way, when you go back and reflect on access to food and nutrition and health outcomes, what is one thing that you wish that the community knew about those three things and how they link together?
So, I would say that, there's so many communities that just they don't have access to like nutrition education, and it's so much more than we think. I think that for a long time, like, I lived in like a certain bubble because I was from, a middle class neighborhood and like never really went anywhere else until I got this job like 3.5 years back and was like, oh my goodness, this is so common. This is so common. And so I think one of the things that like I've learned is that if people, they're not going to make a nutrition change if they don't know how to cook a certain thing, if they don't have the pots and the pans to, if they don't have the resources to make those changes. So that's another thing that we try to address, and that's why, I mean, like we've said over and over again, like knowing like the culture that you're going to feed, and helping them like answer questions about cooking and having like really, really basic level, easy instructions, like literally 5-point instructions on how to you know, cook something. And so that really helps them because then they feel empowered to do it and they're like, oh, I can do this. This is not that hard, but we have to start at that level. Because trying new things for a lot of people when they've been living a certain way it's very daunting and it's very challenging for them. And so we want them to take like baby steps. And then, once they pass that one step, then they feel even more empowered to do the next thing. So yeah, that's what I would say.
I think it's also kind of breaking that generational cycle, right? Because, Hannah talked about how this is all they knew, right? I mean, I grew up every single meal with some kind of fried breaded meat and grease gravy, and it was delicious, right? I would have not known at all that I was very unhealthy. But then it's not till you grow up and again I became a nurse. I'm like, what is my cholesterol? Right? Like I had no idea because that's the way my grandmother cooked. That's the way my mom cooked. That's all I knew, right? And so it's not really until you actually start eating a little bit healthy and then you start feeling a little bit differently. Then when you eat something like that, like I go to my mom's and yes, I want to eat her food, but it actually kind of makes me feel a little not well because it's again we're Southern, right? Everything has a stick of butter in it, and so it's just one of those things. It's about breaking some of those generational cycles, and so just trying to make sure that people understand that this is why maybe your family has this very high history of diabetes or cardiovascular disease or hypertension, right? And so, because I think people just look at, hey, I have food, right? And it's poverty is such a big piece of this, right? Like, um, I I don't know that we've even really talked a ton about that. I mean, the cost of healthy food is expensive. And if you are on a fixed budget and you have to decide between paying rent or, and then you only have a certain amount of money to feed your family of five, or sometimes you have families living in the same home, and it's much more expensive to buy a bushel of apples than three bags of chips. And so we can feed more people and their bellies are full, and that's all I care about. They're more worried about what's going to happen today and not what could happen down the road with a long-term health outcome, right? And so I think that's where we really have to try to like in order to really tip the scale, it's really about trying to make food more affordable. How do we help people to be independent and growing some of their own foods that then they don't have to purchase it. They don't have to buy it because they're providing it for themselves. And of course, there is that little bit of a sense of pride that goes along with that as well. But it's very generational, and we've got to figure out number one, how to break that generational cycle, and then how do we make it more affordable for people.
My grandmother used to tell me, "You are what you eat." And I thought that was just the corniest thing I had ever heard in my life. Um, but there's so much truth in it and so much wisdom. And I wish that people could understand that having high blood pressure or type 2 diabetes isn't inevitable. Well, I'm going to have diabetes when I'm uh, in my 50s because my mother did and my grandmother did, and everyone in my family has it. But there are small changes that we can make that remove that foregone conclusion uh, for a lot of us. Um, Reading labels. Some foods that are very, very inexpensive are just terrible for us, and some of them are not. And knowing the difference, I think, is incredibly valuable. And I wish more people, I wish that was more accessible for people. And I think that's one of the things that programs like ours can help influence. I think all of us are doing the work and making those inroads for the generation of today and the generations of tomorrow.
Thank you very much, Hannah, Kelly, and Melanie, for your insights into your respective markets, the impact you're making on your communities as we honor National Nutrition Month. Before we conclude, I would like to ask one more question, and that is, um, as a member of Mobile Healthcare Association, how have you seen your respective programs to be able to benefit as a result of that membership?
I'll go. I think that it's been just so wonderful to be able to attend these conferences every year and be able to hear that, like, we're not alone in what we're going through as well. I think that, I mean, speaking for me, it's like no one that I know or am friends with has the same job, that I'm doing. And so a lot of times, the struggles are different. And so I think knowing that we're not alone and that it's a journey is really helpful and encouraging. And also just, I mean, gaining knowledge and like getting tips from other people that have done it. It's been so rewarding to talk to people and be able to hear that and implement things in our own programs.
Yeah, I don't know if there's much else to necessarily add outside of what Hannah has done. I mean, I completely agree. I am the only one in my entire system, which is 17,000 employees that can talk mobile, right? I mean, even my VP that I report to is always coming to me with questions, right? What do you guys do here? What do you do here? And there is no point in reinventing the wheel when somebody else might have already started something like that. I might have to take what they did and make it Carl, right? I might have to make it for Illinois because there's different regulations and state guidelines. But there are like those like startup guides and tools that are on the MHA's website that are really great to access because again, as I was just starting some of this stuff, I was kind of like very green and not really understanding what to do. So attending not only the conference, but that intensive training course and then some of the other virtual offerings that are out there because I may not be a mobile mammal, but I might be one day, right? And so I kind of, tap into some of those, those workshops and those learning sessions because I might be like, okay, well now I need this in my neighborhood too. And then the state coalitions and having that networking, having those people that can help guide you, or even just that you can vent to someone. Because again, like Hannah said, they know what you're going through and nobody else really does, right? That there's so many different hurdles and different things that we have to jump through that maybe other departments or other programs might not have to. We're also not money makers, right? So we can be an easily cut program, or we all of a sudden we don't have our funding. So how do we do that sustainability and not just close shop? So, but having that networking, having those quick access to the tools and resources that are on the website are have been wonderful for me.
Don't think there's anything left for me to add. It really is incredible to have the opportunity to connect with other providers across the country who are doing similar work, whether it's with food access or whether it's with primary care. We're all interconnected, and building those networks and learning from each other is the most valuable part of this.
Well, it has been a pleasure to bring you all back together once again for this important and timely conversation. We are incredibly grateful for your time and your generosity in sharing your insights to the members at Mobile Healthcare Association.